Thank you. Our next speaker is Jeff Stier from the National Center for Public Policy Research.
Thank you, and thanks to the committee for taking not only the comments that I'm making very seriously, but I think it says a lot that the committee is not only having a public comment period, which may be required, but I think the attention and the questions that are being asked tells me that the committee takes seriously its role not only in reviewing some of the proposals that have been before it and the testimony before it from panel members and experts, but from the public comment period. I think some of the things that we heard today from all the people that have come out here, I think speak to the importance of this issue to people across the spectrum. And if I could just take some of my time to help, and I think Scott did some of this, but to help kind of bring the tone down a little bit from an accusatory attacking role that sometimes kind of bubbles up because everyone appropriately feels passionately about these issues, whether it's tobacco harm reduction proponents like myself, or some people who don't necessarily see all the benefits, weighing both sides to allowing consumers to see the benefits of switching, of using lower risk products. And if we can just take a moment to kind of lower the rhetoric and recognize that I think we're all here to benefit the public health, and yes, we're obviously there are some competing points of view here, but I think at the end of the day, the committee recognizes, as do some of the vocal people that have given of their time to speak today, all believe that we need to reduce the risk related from tobacco. I think like if that could be a common ground, we get there. At the end of the day, there's going to be a point in time when, and I recognize that TPSAC's role is limited here on dissolvables, and that FDA will eventually have to make recommendations. But at the end of the day, the report that this committee writes will influence FDA, and FDA will eventually have rules, and those rules will affect consumers who are making decisions, not only about whether to use tobacco at all, but how to get off of tobacco. We've seen the people here that have used e-cigarettes. I think that's very powerful testimony that isn't always being captured in all of the studies. So I thank the committee for taking this issue seriously, recognizing that this is a very fast-moving area where if we're focused on dissolvables, and some of the questions have appropriately redirected back to dissolvables, recognize where we'll be in 5 years when we actually have rules in place and people are making decisions in the real world based on limited data. How can we do best to protect public health? So thank you for your time.
Thank you. Questions? Patricia?
We're charged not only to look at public health, but specifically to look at children and the impact that this has on children. What is your stance on that? Because you're just mainly talking about adults right now.
And absolutely, it's appropriate that the committee looks at children and the children who are making choices about what products to use, whether they be cigarettes, which I'd like to see nobody ever smoking cigarettes and nobody ever using dissolvable tobacco. But we live in a world where kids make stupid choices. I think that's I don't know, is there a study on that? That kids make stupid choices. And we want those choices to be based on the best available information. I don't want kids to start using dissolvable tobacco products, but my concern is that if kids begin using cigarettes and those kids never have accurate scientific information about lower risk products, where will they be when they're adults? What choices will they be making when they're already addicted to nicotine? Thank you.
Okay. Patricia?
Just to follow up on that, and do you think the industry is ready to move in that direction? Because based on the information that we have, it's not going that direction, at least based on the industry's document.
Well, ultimately, it's not up. Ultimately, it's not up to the industry because the law requires that FDA come up with rulemakings and guidance for that. So I think it's important that we take into account children's health. At the end of the day, it's going to be FDA that decides, but I think FDA has an obligation to children to make sure that the information that the agency provides and allows industry to provide to adults be based on scientific information, and rather than be concerned only about will kids ever think, because what's going on here, I think the question is a fair question is, what might happen if kids think dissolvable is not so harmful? It's a fair question to ask. But you have to balance allowing scientifically accurate information about risky products to be compared to other risky products. And that if we're interested in protecting kids, we also have to allow for the availability of accurate information to kids on lower risk products. And not just say, as has been said by some before, that all tobacco products are harmful, period. When all tobacco products are harmful, at different levels. I think that's a fair distinction.
Yeah. Tim?
So I would just ask, do you think it would be fair that we should include in our what we share with our children the fact that if they use a lower individual risk smokeless product, including dissolvables, their probability of progressing to smoking is higher, because that is what the data shows so far.
So I think if the data shows that, I think that information provided to children should be based on the science, and I would rather parents tell children never to use any tobacco product or nicotine product at all, but I also think it's important that that information, based on the concerns for children eventually going up to more dangerous tobacco products, I think that information should also be balanced with accurate information about lower risk products that are available. We don't want our kids using any tobacco products at all, but I think you have to balance that with the information that's provided to consumers being based on science at the end of the day. And if there's some information that is bad for dissolvables, let that be. And if there's some information that actually might allow kids to choose to use a product that we don't want them using, if that's what the science is, I think, as so many people on this panel and as FDA have said, I think we ought to put the science out there and let it fall where it may, even if it doesn't always meet our public policy agenda.
Tom?
Yeah, I respect very much the idea that we should be making these decisions based on good science. I wonder what you and your organization think about the situation where we find ourselves, or the future situation when it comes to new products, where a product that has some acknowledged danger and some potential lethality is released for marketing in the absence of any science provided by the companies that are doing the marketing. It makes it very difficult to make decisions, and I wonder if that's the sort of situation you want us to continue to find ourselves in.
Well, I think we find ourselves, and the committee finds itself, and the FDA finds itself, always in a situation where we have to make decisions based on the real world, on limited information. We never have all the information we want. I think there is information that non-combustible tobacco products are less harmful than cigarette smoking, and I think that consumers, and the consumers that my organization represents, many of whom I talk on radio shows about public policy issues, and people don't know. People have never considered that there are less risky alternatives to cigarettes. I think we owe it to people to put that out there, even without all the information available, whether it's through marketing, whether it's through obviously a regulated marketing environment. No, it's not an easy task, but I think there are downsides to being overly regulatory here by the unintended consequence of a very tight regulatory system, which will absolutely protect kids by never giving them any information about different risks. There's a risk that all people will continue to have not enough good information about the issue. But I acknowledge that it is a very challenging environment to regulate, but I think you're not being extra careful by being extra regulatory necessarily.
Okay, thank you.